Hello, everyone. As alluded, I will be presenting on our experience in using this tool in setting our targets. As a country, we started implementing PrEP as demonstration projects in 2017, and we're supported by 3 partners. And based on those results, we approved PrEP as part of the combination HIV prevention package in 2018. And we were to roll out nationally this intervention, and it's being coordinated within the National AIDS Program, which is a unit within Ministry of Health. So based on the demonstration projects, we identified 8 priority populations, which includes serodiscordant couple, sex workers, men who have sex with men, adolescent girls and young women, transgender people, pregnant and lactating women, and high-risk males aged 30 to 34. And as part of the scaling up plan, we're supposed to come up with targets, which included the national, regional to us it's equivalent to the district, and also to disaggregate further by the subpopulation or the priority populations. And we were lucky this year in June, as we're struggling in coming up with in setting up the targets. We were part of the countries that were supported by USAID to benefit from the PrEP tool workshops, which were implemented through Health Policy Plus, Option, ETAP 2 projects. And we're very excited when we saw that one of the functions of this tool was to set the target where we're struggling. And we took this opportunity to set our targets, which were to be national, regional, and also per a subpopulation group. Next slide. So the process of setting the targets as we're using this tool, what we have seen is that the tool does not automatically set the targets. However, it provides a useful framework for discussing the desired approach and key assumptions. Also, the tool provides a visual way to show the impact of decision as it relates to the target setting. So during the workshop as a country, we chose the option 1 coverage approach, which is a top-down approach that we later modified to include desired coverage of the specific population, site capacity, and we also consider the number of sites that we're going to be providing PrEP in the country. Then in terms of the priority populations, as I've alluded, that we did identify about 8 populations based on our demonstration project. So during the process of target setting, we considered their population sizes per population group. We also considered the HIV prevalence, which we got from our local data. Where we didn't have data, we considered what is available globally. However, I must say, under the, again, when we wanted to determine the percentage indicated for PrEP within this population, that one was very difficult. We ended up using the default figures to start the discussion and consider the dynamics of these groups. What we also saw using this tool, we're able to come up with continuation curves for the general population based on the demonstration project data, the continuation rates, and we're also to use the same continuation rates that we got from the demonstration projects for the different priority population. So this tool helped us to understand the consequences of changes in the continuation rates. So as we are scaling up PrEP, we have decided as a country that we are going to use the program data tab, which is part of the tool, to integrate in our M&E system to track the progress of the intervention. That is our PrEP cascade. And we have also seen that at this stage, as we're rolling out, since we haven't integrated the PrEP module in our CMIS, it's not easy to track what is happening with this intervention. But then as we continue with the integration of PrEP module in the CMS, we think that it's going to be helpful to also understand the progress in rolling out this intervention. Then for the coverage, we use the experience from the demonstration study and program goals that we had there to inform our coverage. So it's easy to adjust by playing around with the coverage when we are using this tool. Thank you.
So next, I think we're going to have Joseph speak about the experience in Zimbabwe.
Hello, everyone, and thank you for the opportunity for us to share our experiences on the. So just to start off by highlighting our journey in terms of PrEP in Zimbabwe, I think our main milestones were the development of the guidelines in 2016 and having the first pilot implementation in the public sector in 2017. And within that period, we also had a chance to use some of the tools that were developed with support from Options, including the landscape analysis, rollout scenarios, and readiness assessment. And then in 2018, we launched our national PrEP implementation strategy. We are currently in year 2 of implementation. More recently, we have launched the comprehensive HIV communication strategy, which also looks at communication for PrEP. And as of now, we have over 11,000 people. But I wanted to bring your attention to the time point at which we started the process of developing the PrEP tool, which was after the development of the national implementation strategy. This is important because it will help you understand some of the challenges we faced as we're going through this process. Next slide, please. Yeah, so the development of the PrEP tool was a widely consultative process with different stakeholders participating in the process. So we had mainly the National PrEP Technical Working Group, which is led by the Minister of Health and Childcare, but also has implementing and funding partners. And the main players in this process were Pangaea, PSI, CHAI, and we also had the team from USAID and CDC participating in the exercise. Also, we had an opportunity for the program managers from different organizations as well as PrEP providers in both the public and private sector participating in this exercise and also practicing on the use of the tool. So this helped a lot in terms of getting buy-in, but also in the refinement of the tool to suit local needs. Next slide, please. So when the tool was introduced, there was a lot of excitement because based on the implementation experiences, the tool had the potential to address some of the gaps that we had identified, notably issues to do with subnational levels, because we're struggling in terms of how to set up targets for districts and facilities. But also the issues that we were struggling with was how to monitor and track continuation. So this came at the right time because it was going to then help us address those two main areas. The good thing also is the tool is Excel-based, but the engagement of everyone in the development of the process meant the tool was also going to be responsive to our needs. Yeah, just to highlight some of the challenges that we came across when we're developing the tool. The main one was the unavailability of local data, not but also size estimates for some of the population groups that are prioritized for PrEP. For example, men who have sex with other men, and this was needed to inform the assumptions. We also had some challenges convincing stakeholders on the added value, given that we already had this. We also had modeling and costing exercises going on at the time of initiation of the development process. However, as we went through this process, we then managed to get buy-in as people then started to appreciate the value from the tool. Next slide, please. So our last stakeholders meeting was in June, and since June 2019, we've received some feedback in terms of people's experiences in terms of using the tool. The first thing to highlight is that people are finding the tool overall functional and useful, and it's also quite comprehensive in terms of mainly target setting and tracking continuation. This is mainly because the stage where we are in terms of PrEP rollout in the country, the main focus in initiations and continuation. So those are the two most popular components of the tool that are being used mainly at subnational level. However, the challenge is that some of the facilities that might want to use the tool is that they don't have laptops or computers or electricity on site, so it becomes a challenge for them to use the tool. But also just to highlight that some of the tools at subnational level, and especially, for example, the costing tool, because resources are allocated from national level and at district and facility level, there's nothing much they do in terms of allocation and costing. So there hasn't been a lot of use of the costing component. So what was being used mostly are the target setting, evaluation, and the impact components. So going forward, next slide, please. As we continue to roll out PrEP in the country, we are going to be training people on the use of the tool and then disseminate it further through training and mentorship, and also to then monitor implementation through tabs. At a higher level, the plan is to use the tool to refine our national targets on an annual basis, but also to use the tool to inform planning process, including more recently the quantification exercise that we have just had, because some of the assumptions that we use can be generated from the tool. Thank you very much.
Great, thank you, Joseph and Cindy, for sharing your experiences. And I think that we really appreciated all the feedback we got from the partners in Zimbabwe, Eswatini, and Mozambique, and Kenya. They really helped us to push us to try to improve the user interface. And I think that we have a better product as a result of their collaboration.